I'll be talking about discovery and applications of novel antibiotics today, and as I expected, Stephen Polyak has already introduced very nicely the need for new antibiotics, so I don't need to revisit that. How do I change slides? Oh, thingy here. Okay. The problem that we are addressing is that of the antibiotic resistance that has occurred, and commonly the term superbugs. And particularly Staphylococcus aureus is a big problem, the golden staph that Steve already referred to. And there's clearly a need for novel antibiotics, as you heard. However, even more pressing is the need to combat infections at biomedical devices. And infections at biomedical devices and implants are due to the formation of bacterial biofilms that are much more difficult to control than isolated bacteria that might be in your body at other places. Because once bacteria settle on an implant surface or on a catheter, they form a protective slime layer of extracellular polysaccharides that makes it much harder for the immune system to get to them, and also makes it much harder for antibiotics to combat them. And this problem occurs, for example, with urinary catheters, which have got an almost 100% infection rate within 7 days. And there's also a rate of hip and knee implant infections of about 3 to 4% in every country in the Western world, despite best procedures in hospitals. They're thought to arise from bacteria that come in after the surgery through the bloodstream to the incompletely healed wound site and cause problems there. So the solution to this problem could be antibacterial coatings, which we want to apply as very thin protective layers to stop bacteria from attaching onto catheters, biomedical implants, orthopedic implants, and contact lenses and the likes. This is an example of a biofilm which was then studied in an electron microscope. So you can see all the individual bacteria here. Those egg-shaped things are individual Staphylococcus. And this fuzzy stuff is the dried down slime biofilm that they protect themselves with, the extracellular polysaccharide layer. If you've got this on your hip implant, then you're in trouble. That is actually from an explanted hip implant where the patient suffered an infection and the hip implant had to be taken out and replaced again, which is of course traumatic for elderly patients. The solution is that one of the two solutions which I'd like to talk about today is the discovery of novel antibacterial compounds, which are of the cerolatane class in Australian plants, outback plants. Eremophila, desert lovers, tells you that they grow in the outback, and that's one of them here. And these classes of compounds, we have found, are very highly active, even against methicillin-resistant golden staph. So they kill those superbugs. We have now about 15 of these different compounds isolated from different plants, so we're starting to look at structure-activity relationships. One of the things that got our collaborators overseas really excited was that these compounds do not cause breakage of the bacterial membrane as measured by ATP release. In other words, they don't just destroy the bacteria like many other disinfectants do, which then causes leakage of compounds from within the bacteria. They work directly on the outside of bacteria. We have developed methods for coating these compounds onto a wide range of biomedical devices, totally stopping biofilms, and I'll show you an example in a sec. We've done that on standard plastics, on orthopedics products, and also onto membranes, so we can make membranes totally free of biofilms. One example is shown here, where we are looking down a microscope onto samples after 4 hours of exposure to a bacterial solution of 1 million bacteria per milliliter, and the samples were put into that broth solution. So the bacteria were given 4 hours to attach to the surface, which they love doing, and then we wash it lightly. We stain the bacteria with a fluorescent compound, and on the control plastic, we see that a couple of hundred bacteria have managed to attach on there. And when you look after a day, they've started forming a slimy biofilm. Our surface, which is coated with these compounds, has remained totally free of bacteria. So it's a very clear efficacy proof. We're now taking this to orthopedic devices in collaboration with an overseas company, but there's many other opportunities still. The methods are also under development for the controlled local release of these compounds. So far, we've attached them covalently, so they stay there permanently, but we're also looking at release mechanisms now. The benefits are that we can make biomedical devices that resist bacterial formation. So, for example, orthopedic devices, including fixation screws and that. And this could, of course, also be applicable to other things like membranes, air conditioners, hospital tools, kitchenware. You've probably got a lot more ideas about this than I do because I specialize in the biomedical devices field. And so it's high value-added products that address a consumer concern. We see these coatings of these compounds as a high value-added solution to many devices. The second solution we've developed is based on silver release. Silver is a well-known antibiotic, and there's wound dressings, for example, Acticoat on the market, but they have certain disadvantages. And we've tried to overcome those by putting thin layers on top in which we put the silver, so it's not throughout the entire wound dressing. So it's only on one side. Again, for example, for contact lenses, that's very important. Then we put a second layer on there, very, very thin layer, that gives us control over the release kinetics. So we can now actually fight bacteria over a couple of days, or over a week, or over several weeks. And we can design controlled release of silver over various time intervals. So again, depending on the product you have, we can offer you a different coating solution there. And we're looking at, of course, combining this with a previously mentioned cerullatane technology on the previous slide. So then, depending on the bacterial combinations, we can then have a solution that has different activity spectra against different bacterial groups or classes. We have taken out 2 patents on the cerullatanes and on the silver concept. The first one is going through a number of national phases now, and so far we haven't seen any significant problems in protecting both the compounds nor the coatings. The silver patent is slightly behind that, but it's again going there. And this one is actually now in a clinical study as well. With the cerullatanes, we've identified the best compounds. We've developed coating technologies, and we're currently going through trials on orthopedic products with an overseas company. For the silver ion release, we're doing here at the IMVS in vivo studies with rabbits to establish the proof in an actual animal infection models. So we deliberately infect implants that we put into the rabbits, and then we see how well the silver can clear it versus a control. And so the opportunity is both for standalone cerullatane antibiotics that are extremely effective, especially in breaking up biofilms faster than any other compound we've ever tested, and also kill golden staph. And they are organic antibiotics extracted from plants. Aeromophila plants grow on land that is useless for traditional agriculture. So you could grow a few square miles of these plants out there at Fort Augusta and harvest the compounds, and that could certainly form the basis of an industry here. It's ready for industrial scale-up in terms of the extraction and production of these compounds. The coatings can be applied to a wide range of products in the coating scenarios we've developed. And of course, we're looking at further opportunities, different coating schemes for different products, and I'd be happy to talk with you about that. Unfortunately, I won't be around for the afternoon, but Mark Bruce of iTech will be here to talk with you about that. So we're looking for opportunities to develop both novel antibiotics as well as coatings beyond some of the biomedical devices markets that we have already started tapping into. Thank you.